The visa medical, what the doctors or nurses tell you. If you apply for an Australian partner visa, that means spouse visa or fiancé visa, or a New Zealand citizen's family relationships visa, or a child visa, then you need to do a visa medical examination. They can also request X-ray examinations or even full medicals for tourist visas if they think the applicant is a risk, especially if they're elderly or going to attend school or a hospital in Australia, or if they think they will be staying longer than the standard 3 months. They do all this because they don't want to bring anyone who doesn't pass the health criteria into Australia. They don't want the expense or the drain on resources to affect Australia and Australian citizens. And one of the more immediate concerns is they absolutely wish to keep tuberculosis, or TB, out of Australia. This is a nasty, debilitating lung infection which can lead to deaths if untreated. It's endemic in the Philippines and common amongst the poorer folk. Fortunately, it responds well to treatment, but it always comes to a shock to those who get it. No one ever says, "Yes, I thought I might have had it." It's not so obvious, as everyone has a few coughs from time to time, and it can be a crafty little critter when it comes to X-rays too. The diagnosis of tuberculosis in the Philippines. If you Google this, you can see that there is a skin test which can be taken to see if the person has been exposed to TB. In the Philippines, this is totally useless. Why? Because everyone here is exposed to it. Everyone shows up positive. And there are no blood tests. The only way is looking at X-rays with an experienced eye and identifying lesions in the lungs. And this is not always easy or obvious. I can share our experience. We've taken in kids here who've had it, and we've had them treated successfully, 3 to date, and all in excellent health now. I was with them when they were diagnosed, and I can assure you it wasn't straightforward. Our family doctor has maybe 30 years of experience, and it generally took several X-rays, sometimes from different angles, before they were absolutely certain. And we had one case where one child had a lung infection, which meant the lungs were congested already. Couldn't see a thing. Seeing as her sister had been diagnosed with tuberculosis already, the doctor took a punt and put her on TB medication anyway, just in case. A later chest X-ray a month later showed there were no lesions, but it was considered not worth taking such a risk. Visa medicals. The actual process. The visa applicant is sent off to one of the authorised clinics, which are known as panel doctors for some reason known only to them. You can't see the local family doctor, sorry. The authorised panel doctors are trusted to do their jobs properly and not be open to corruption. However, this is still the Philippines, and the staff will always be Filipino and will always want to be nice and helpful. The examinations take place and the results are sent to the medical officer of the Commonwealth, the MOC, which is a section of the Department of Immigration and Border Protection, which takes care of whether the visa applicants meet the health criteria or not. They are the decision makers. Based on the doctor's report, including any X-ray findings, the MOC will either give it the thumbs up or will give it the thumbs down. In cases where X-ray results are not conclusive, they will send through an instruction to Down Under Visa requesting further tests be done. This may include further X-rays, or it may include sputum tests, so they can see if TB bacteria can be cultured from the sputum. A note that the MOC has one job to do, and that is to assess against the health criteria which is written into law. They have no interest whatsoever in whether flights are booked or if you want to be together at Christmas time or not, and they will not be influenced at all. And we can't hurry them up, so please don't ask us to do so. And it can be a very slow process, I'm sorry to say. What if the clinic staff tell you something different? Filipinos are a helpful lot, and they like telling you good and helpful things. No one wants to be the bearer of bad news or uncertainty. So it happens that doctors or nurses will tell our clients things that are not necessarily true. Examples: your results are all good and clear. Your results will be sent to the embassy in a few days. Don't worry, you don't have TB. It is not their decision to make. This is especially the case if results are not certain, and it's even more so if it's the nurse who gives you the all clear. If a doctor of 30 plus years won't give the all clear without sometimes 3 additional x-rays, then I wouldn't listen to anyone giving you advice on the day. Thank you. Thank you. I hope you enjoyed this video. If you enjoyed it and you would like to subscribe, you can click on the little button down the bottom corner there, and you can subscribe to our YouTube channel. There are regular articles on aspects of Australian visas to the Philippines on www.downundervisa.com.au. There's a blog page you can subscribe to. There is a free visa assessment form, and there are regular articles on aspects of Australian-Filipino relationships, which you can see on www.filipinowives.com.au. If you can please share these articles and these videos on any of the social media that you use, we would appreciate that. Thank you.